Guadalupe says, I would appreciate general recommendations for managing POTS. Okay, that's a big bite, right? My POTS symptoms are significantly improved. I used to be completely bedridden, unable to read, barely able to eat, etc. Paracin Plus, Paracin Plus, that's a supplement I patented and put out, is one thing that improved my digestive and cognitive functions. That is awesome. But physical movement remains a problem. I can run around with my little nephews for a few hours, but then a few hours, that's good. But then I'll have incapacitating high pressure in my head, eyes, and neck, which only subsides after a few days of pretty much staying in bed. I'm just wondering if there are general lifestyle, I'm sorry, let's cut this off. I think it's recommendations about POTS. It is secondary, though. Do you know that? It's secondary to something else, okay? Something likely inflammatory. And one clue we have is you responded to Paracin Plus. So, and anybody who responds to Paracin Plus, it means inflammation's driving that somehow. Do consider NAC-MAX. That controls the oxidation that is secondary to the inflammation. And the oxidation further damages blood vessels, it can affect organs, and it can change our brain chemistry. And when oxidation increases, we get more anxiety type symptoms, and it may exhibit like as anxiety. I just spoke to somebody who, she was getting to the point she had trouble leaving her home. Don't let it get that bad. Okay. A fear of heights, oddly, but it also exhibits like an overachievement. We're at the top 1% of everything. We like things a certain way. We get into details. We're detail oriented, and we expect other people to be the same. And they're not always like that. So we can end up being very hard to live with, hard to work for, because our bar is so high. So moderating that and allowing yourself to live in life more normally is hugely helpful for relationships in your future. I know most inflammatory patients, I'm an inflammatory patient, doesn't mean I'm sick, I'm not sick. But most inflammatory patients still lean that way. We tend to be fairly detail-oriented. We get a lot done. And I think society rewards that. So enjoy that. But NAC-MAX can help take some of that negative aspect of it down. And I hope that's really helpful for you.